never know when an emergency may strike. As a child care provider, there are several types of emergencies that may impact you, including weather events such as snowstorms, tornadoes, floods and earthquakes, fire, electrical outages, medical emergencies, intruders, and more. In Missouri, licensed child care providers are required to have an emergency preparedness plan. The primary goal is to always protect the health and safety of your children in your program. Having an emergency or disaster plan allows you to better prepare to react, protect, and respond to those in need if an event should occur. Your emergency response plan is dependent upon identifying the types of emergency that is occurring. Different types of responses include evacuation, shelter in place, temporary closing, and lockdown. Once the situation has been identified and the appropriate response been determined, it is time to activate the emergency response plan. Make sure information is clearly communicated to all staff members and children in your care. Gather any necessary supplies and provide first aid if needed. Emergencies often happen suddenly and unexpectedly. That's why preparedness is key. When developing your emergency plan, it is important to consider the age and physical and mental abilities of the children, the types of disasters or emergencies that are most likely in your area, and the need for ongoing communication with other agencies. Create a clear and comprehensive written outline of your policy and procedures. This should include medical and non-medical emergency and disaster situations, evacuation from the facility, diagrams identifying exit routes and relocation sites, lockdown procedures, and evacuation from a vehicle used to transport children. Your plan should also include the location of the children's attendance records, emergency information and supplies, a current list of emergency contacts, a list of procedures to follow, and a list of staff members and their responsibilities. As you develop your emergency plan, it is also important to build an emergency supply kit. Experts recommend you have enough supplies and food in your kit to last at least 72 hours. You will want to include sanitary and hygiene items such as a first aid kit, diapers, toilet paper and wipes, hand sanitizer, and medical gloves. You should also include food items like bottled water, dry or canned infant formula, and non-perishable foods and snacks. Other useful items for your emergency kit include flashlights and batteries, alternative power sources, cell phone chargers and power banks, a non-electric can opener, matches in a waterproof case, blankets, and games or activities to entertain the children. Make sure the items in your kit don't expire. It is helpful to appoint someone to routinely check expiration dates. When a food item is near expiration, consider using it and replacing it. Access to the emergency plan should be available at all times with copies posted in the office and in each room used for childcare. Contact information including the facility's name, address, and phone number, as well as a list of emergency numbers, should also be posted in each room and beside each telephone in the facility. At least every 3 months, all staff and children at the facility should participate in a disaster or emergency drill based on the emergency plan. Staff should be trained and up to date on their duties and responsibilities in an emergency situation, the use of the fire alarms and fire extinguishers, and how to perform CPR and other first aid. Emergency preparedness saves lives. For more emergency preparedness tools and resources, visit health.mo.gov/safety/childcare.